Research is hard, but your tools should not be. Subthesis.com is the free alternative to expensive software. Whether you need to calculate Cronbach's alpha or organize your field notes, Subthesis has a tool for it. No paywalls and no registration required. Check the link in the description and let's dive into today's lesson. Welcome back to the Graduate School Prep series. This video connects public service loan forgiveness specifically with public health careers. For many public health professionals, PSLF represents a rare alignment, a program that rewards exactly the career choices you'd make anyway. Public health, by definition, focuses on serving populations and communities. Most public health work happens in government agencies or nonprofit organizations. These are precisely the employers that qualify for PSLF. This means that pursuing your public health calling can also be your optimal financial strategy. The educational debt that might seem to push you toward higher-paying private sector work can instead be forgiven through the public service work you wanted to do regardless. By the end of this video, you'll understand how PSLF specifically applies to public health careers and how to strategically position yourself for forgiveness while doing meaningful work. Here's what you'll learn. First, you'll understand how public service loan forgiveness connects with typical public health career trajectories. The alignment is strong for most public health paths. Second, you'll identify specific qualifying public health employers and positions. Not all health-related employers qualify. Knowing the distinctions matters. Third, you'll develop career strategies that maximize PSLF benefits while pursuing meaningful work. Strategic thinking enhances outcomes without compromising your mission. Fourth, you'll navigate the intersection of career satisfaction and financial optimization. Sometimes these align perfectly, sometimes trade-offs exist. Let's start with why PSLF and public health fit so well together. Public health and PSLF align for fundamental reasons. The public health mission inherently serves communities and populations. Whether preventing disease, promoting health, or addressing inequities, public health work serves public interests. This aligns perfectly with the public service spirit PSLF was designed to encourage. Most public health employers are either government agencies or nonprofit organizations, both qualifying categories for PSLF. State and local health departments, federal agencies like CDC, nonprofit hospitals, community health centers, and advocacy organizations are where public health professionals work. PSLF rewards exactly what your public health training prepares you for. You didn't pursue an MPH or DRPH to maximize private sector earnings. You pursued it to do public health work. PSLF makes that choice financially viable even with significant educational debt. This means your financial and professional goals can align rather than conflict. Instead of choosing between doing what you love and managing debt responsibly, you can do both. This is rare in career planning and shouldn't be undervalued. Government employers at all levels qualify for PSLF and employ public health professionals extensively. Federal government employers include the Centers for Disease Control and Prevention, the National Institutes of Health, the Food and Drug Administration, the Health Resources and Services Administration, the Centers for Medicare and Medicaid Services, and the Indian Health Service. These agencies hire epidemiologists, health educators, program managers, policy analysts, and many other public health professionals. State government employers include state health departments and Medicaid agencies. Every state has a health department with diverse public health roles. State-level work addresses population health, disease surveillance, health policy, and program implementation. Local government employers include county and city health departments. Local public health is where much direct community work happens. Contact tracing, restaurant inspections, vaccination campaigns, and community health assessment occur at the local level. Tribal government employers, including tribal health agencies and programs, qualify as government employers. For those committed to serving Native American communities, this provides both qualifying employment and meaningful work. Nonprofit employers also qualify for PSLF and represent major public health employment settings. Nonprofit hospitals and health systems employ public health professionals in population health management, community benefit programs, and quality improvement. Most hospitals are organized as nonprofits and qualify for PSLF. Federally qualified health centers provide primary care to underserved populations and employ public health professionals in clinical support, outreach, and program management roles. These community health centers are foundational to safety net care. Public health advocacy organizations work on policy change, health equity, and specific health issues. Organizations like the American Heart Association, American Cancer Society, or disease-specific foundations employ public health professionals in research, education, and advocacy roles. Community-based health organizations serve specific populations or address particular health issues at the local level. These smaller organizations do direct community work and qualify for PSLF as nonprofits. Verify specific employer qualification through the PSLF Help tool, but most nonprofit health organizations qualify. Not all health-related employers qualify for PSLF. Understanding non-qualifying employers prevents strategic errors. For-profit hospitals and health systems don't qualify regardless of the health services they provide. The for-profit corporate structure disqualifies them. If you're considering a hospital position, verify whether it's non-profit or for-profit. Pharmaceutical companies and insurance companies don't qualify. Despite their health industry connections, these for-profit entities don't meet PSLF employment requirements. Careers in pharmaceutical or insurance sectors require different loan strategies. Private consulting firms, even those focused on health and public health, typically don't qualify. If you're working for a consulting company rather than directly for government or nonprofit clients, you likely don't qualify for PSLF. Some health-adjacent businesses fall outside qualifying categories. Health tech startups, private medical practices, and for-profit health services don't qualify even though they're health-related. Career choices in these areas require different financial planning. Let's examine how typical public health career paths interact with PSLF qualification. The epidemiologist track often progresses from local health department positions through state roles to federal positions at CDC or similar agencies. This entire progression involves qualifying government employment. PSLF works throughout your epidemiology career. The health educator track might start with community-based program delivery, progress to program management, and advance to organizational leadership. Whether in government agencies or nonprofit organizations, these positions typically qualify for PSLF. The policy track often involves analysis positions in government or nonprofit settings, progressing to senior policy roles and leadership positions. Government policy positions obviously qualify. Nonprofit advocacy positions typically qualify as well. The research track in academic or institute settings involves positions at universities or research institutes. Public and nonprofit universities qualify for PSLF. Research institutes organized as nonprofits qualify. Academic research careers align with PSLF when at qualifying institutions. Most traditional public health career paths involve qualifying employment throughout. Strategic career planning optimizes PSLF benefits without compromising your career development. Prioritize qualifying employers when considering positions. If two positions are otherwise comparable but one qualifies for PSLF and one doesn't, the qualifying position has significant additional value. Factor PSLF into job decisions. Understand that not every position must qualify. If a non-qualifying opportunity offers exceptional career development or significantly higher salary, it may be worth the PSLF interruption. 120 payments don't have to be consecutive. You can return to qualifying employment later. Track qualifying payments systematically throughout your career. Submit employment certification annually. Know your count. Don't let administrative failures undermine years of progress toward forgiveness. Plan career transitions thoughtfully. When considering moves between qualifying and non-qualifying employers, understand the financial implications. How many qualifying payments have you made? How many remain? What's the forgiveness value at stake? Understanding the financial value of PSLF helps you make informed career decisions. The forgiveness value depends on your remaining balance after 120 qualifying payments. On income-driven repayment with modest public service salary, your payments may barely touch principal. Significant balances often remain after 10 years. Income-driven payments often leave large balances. If your payment is $300 monthly and your accruing interest exceeds that amount, your balance may remain stable or even grow slightly until forgiveness. What you'd owe without forgiveness is substantial. Forgiveness can equal tens of thousands to hundreds of thousands of dollars depending on your debt level and payment history. Someone with $100,000 in debt making income-driven payments for 10 years might have $80,000 or more forgiven. The value increases with higher debt and lower income. Higher debt means more to forgive. Lower income means lower income-driven payments, leaving more balance at forgiveness time. Paradoxically, PSLF is most valuable for those with the most challenging debt situations. Compare PSLF to alternative strategies to confirm it's optimal for you. PSLF versus aggressive repayment involves trade-offs. Higher-paying, non-qualifying employment might let you pay off loans quickly, but would you sacrifice career satisfaction? Model both scenarios with real numbers before deciding. PSLF versus income-driven repayment forgiveness at 20 to 25 years differs significantly. PSLF is tax-free. IDR forgiveness may be taxable income. PSLF completes in 10 years. IDR forgiveness takes longer. PSLF requires qualifying employment. IDR forgiveness doesn't. For those in public health who'd work in qualifying employment anyway, PSLF is typically superior. Career satisfaction should factor alongside financial calculation. Even if non-qualifying employment offered financial advantages, would you be happy doing that work? Public health professionals often chose the field because they care about the mission. Don't sacrifice career satisfaction for financial optimization you may not actually need. Model different scenarios for your specific situation. Use loan calculators to compare strategies. What would you pay under each approach? What's the forgiveness value? What would you earn in different positions? Make decisions based on your actual numbers. Early career decisions significantly affect your PSLF outcome. Start qualifying payments as soon as possible. The clock starts when you make qualifying payments in qualifying employment on a qualifying plan. Don't delay enrollment in income-driven repayment because you think you should pay more. Lower payments accumulate toward forgiveness just as effectively. Your first positions set trajectory for PSLF. Entry-level positions in government or nonprofit public health start your qualifying payment count while building experience for advancement. Early qualifying employment provides foundation for both career and loan strategy. Lower early salaries actually benefit PSLF. Income-driven payments are lower when income is lower. Lower payments mean more balance remaining at forgiveness. Entry-level salaries in public service, while challenging to live on, maximize PSLF value. Build toward management and leadership while accumulating payments. You don't have to stay in entry-level positions forever. Career advancement can happen while remaining in qualifying employment. Management at a nonprofit pays better and still qualifies for PSLF. Mid-career transitions require thoughtful PSLF consideration. Movement between qualifying employers works fine for PSLF. Moving from a local health department to CDC or from a nonprofit to a university doesn't interrupt your qualifying payment count as long as both employers qualify. Career advancement within the qualifying sector continues your progress. Non-qualifying detours pause your count but don't reset it. If you spend 2 years at a non-qualifying employer, your count pauses but doesn't return to zero. Returning to qualifying employment resumes accumulation. This provides flexibility for career exploration. Consider PSLF status when evaluating opportunities. If you've made 80 qualifying payments, you're 2.5 years from forgiveness. A non-qualifying opportunity would need to offer substantial advantages to justify delaying significant forgiveness. The value of remaining forgiveness affects your decision calculus. With few qualifying payments, switching to non-qualifying employment costs little. With many payments accumulated, the opportunity cost of leaving is substantial. Calculate the actual forgiveness value at stake before making moves. Proper verification and documentation protect your PSLF investment. Verify employer qualification before accepting positions using the PSLF help tool on studentaid.gov. Don't assume, confirm. Discovering after years that your employer didn't qualify is devastating. Submit the employment certification form at least annually. This creates official record of your qualifying employment and tracks your payment count. Annual submission catches problems early and builds documentation for eventual forgiveness. Track your qualifying payment count yourself, not just through official channels. Maintain your own records of payments made, employment dates, and submitted certifications. If discrepancies arise, your records support your case. Keep records of all employment and payments. Save pay stubs, employment verification letters, tax returns, and payment confirmations. If you ever need to prove your history, documentation matters. Administrative errors happen. Servicers have made mistakes. People have been wrongly denied forgiveness until they provided documentation proving their eligibility. Protect yourself with thorough records. Avoid these common pitfalls that derail PSLF progress. Being on the wrong repayment plan disqualifies your payments. Only income-driven plans and standard repayment qualify. Graduated and extended plans don't qualify. If you're on a non-qualifying plan, switch immediately. Payments made on wrong plans don't count. Your employer might not actually qualify despite being in healthcare or public service. For-profit hospitals, private practices, and some organizations don't qualify. Verify, don't assume. Failing to consolidate direct loans correctly before starting PSLF can cause problems. Only direct loans qualify. If you have older FFEL loans, they must be consolidated into direct loans, but consolidation resets any prior qualifying payment count. Understand the consolidation implications for your specific situation. Not certifying employment consistently leaves gaps in documentation. Annual certification builds your record. Sporadic certification creates uncertainty about your history. Stay consistent with administrative requirements. Family considerations interact with PSLF in important ways. Family size affects income-driven payment calculations. Larger families have lower discretionary income and thus lower payments. This isn't gaming the system, it reflects genuine financial obligations. Growing families may see payments decrease. Parental leave doesn't interrupt qualifying employment for PSLF purposes as long as you remain employed. Taking leave to care for a new child doesn't break your employment qualification if you're still an employee of a qualifying employer. If you're married and filing jointly, spouse's income affects your payment calculation under most income-driven plans. This can increase payments. Filing separately may lower payments but has other tax implications. Consider the trade-offs. Long-term family financial planning should include forgiveness timing. When will your loans be forgiven? How does that align with major family expenses like children's education? Forgiveness at year 10 provides financial flexibility for subsequent family goals. Beyond PSLF, other loan programs specifically support public health professionals. The National Health Service Corps Loan Repayment Program provides direct loan repayment for health professionals serving in underserved areas. This includes some public health roles in qualifying shortage areas. Payments are direct to your loans and tax-free. State loan repayment programs exist in most states for health professionals willing to serve in designated shortage areas within that state. Programs and amounts vary. Research your specific state's offerings. Indian Health Service loan repayment supports health professionals serving Native American and Alaska Native communities. This provides direct loan repayment for commitment to IHS service. These programs can combine with or substitute for PSLF depending on your career choices. Some offer faster forgiveness in exchange for more restrictive service requirements. Evaluate which programs match your career interests and provide optimal financial benefit. Implement these practical steps to make PSLF work for your public health career. Enroll in income-driven repayment immediately after graduation, even before your grace period ends. $0 payments during grace period and qualifying employment count toward PSLF. Don't wait to start accumulating qualifying payments. Verify employer qualification through the PSLF help tool before starting any new position. Confirmation before you commit prevents surprises and disappointment later. Submit your first employment certification form within the first months of starting a qualifying position. Don't wait years to discover problems. Early submission catches issues while they're fixable. Set annual reminders to recertify your income and employment. Income-driven plans require annual income recertification. Employment certification should be submitted annually. Build these administrative tasks into your routine so you don't forget. These steps seem bureaucratic, but they're essential. PSLF rewards those who play by the rules and document their compliance. Don't let administrative failures undermine years of qualifying work. Let's step back to the big picture of aligning career and financial health. Public health careers can be financially sustainable. The narrative that public service requires financial sacrifice isn't entirely true. With proper planning, you can do meaningful work and achieve financial stability. PSLF enables pursuit of your public health mission without crushing debt burden. The educational investment required for public health leadership becomes manageable when forgiveness awaits at year 10. You can afford to choose mission over money. Financial stress shouldn't drive you from public service. Too many talented public health professionals leave for higher-paying private sector work because debt pressures seem unbearable. PSLF provides an alternative that lets you stay in public health. Plan thoughtfully and execute systematically. PSLF isn't automatic. It requires understanding the rules, choosing qualifying employment, staying on qualifying repayment plans, and documenting everything. Those who plan well and execute consistently receive forgiveness. Use this checklist to take immediate action on PSLF. Verify your employer qualifies using the PSLF help tool on studentaid.gov. If you're currently employed in public health, check now whether you're in qualifying employment. If not, understand what would need to change. Confirm you're on an income-driven repayment plan. Log into your servicer's website and verify your current repayment plan. If you're on graduated, extended, or another non-qualifying plan, switch to income-driven repayment immediately. Submit the employment certification form if you're in qualifying employment. Download the form from studentaid.gov, have your employer complete their section, and submit it. This starts your official PSLF record. Calculate your expected forgiveness amount. Use the loan simulator on studentaid.gov to estimate what your remaining balance will be after 120 payments. Understanding the value at stake motivates consistent execution. These steps take an hour or two total. The financial value of getting PSLF right can be tens or hundreds of thousands of dollars. The investment is more than worthwhile. Let's summarize the key points about PSLF and public health careers. Public health careers align naturally with PSLF qualification. The work you want to do typically happens at qualifying employers. This alignment means you don't have to choose between financial responsibility and career satisfaction. Most government and nonprofit public health employers qualify for PSLF. Federal, state, and local health agencies qualify. Nonprofit hospitals, community health centers, and advocacy organizations qualify. The public health employment landscape is largely PSLF friendly. Strategic planning optimizes both career development and financial outcomes. Prioritize qualifying employers, start payments early, track progress consistently, make career decisions with PSLF implications in mind. Thoughtful planning enhances outcomes. Documentation and consistency are essential for PSLF success. Submit employment certification annually. Maintain your own records. Don't let administrative failures undermine years of qualifying work. In our final video of this section, we'll discuss budgeting as a graduate student, providing practical guidance for managing limited resources during your educational years. Thank you for your attention, and I'll see you in the next video. Writing the thesis is a marathon, not a sprint, but you do not have to run it alone. If you are feeling stuck with your data or overwhelmed by your sources, let us help. Head over to subthesis.com. It is completely free and designed to make your life easier. You are making progress. Keep going. And don't forget to subscribe for more support.